Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the September 29th, 2021 update from the Dubuque County Public Health Incident Management Team. Dubuque County and the entire state of Iowa continues at high transmission for COVID-19, with the COVID case rate for Dubuque County in the last 7 days at 175 per 100,000 population and a 7-day positivity rate of 5.5%. Back on August 26th, the rate was 139 per 100,000 population. We are making little progress on turning the curve downward, and the unvaccinated people continue to fuel this latest surge. Of course, there are breakthrough cases in fully vaccinated individuals, which is predictable in aging populations and those with immune systems that don't produce adequate or long-lasting response. Last week in Iowa, the unvaccinated accounted for 81% of hospitalized COVID-19 patients and 85% of the COVID patients in the ICU. The fact that the COVID-19 vaccine prevents severe illness and death is clear. Schools have impacted this surge, and unfortunately not all children 12 years and older have been vaccinated. Only 40% of children 12 to 15 years old and 47% of 16 and 17-year-olds in Dubuque County are fully vaccinated. If these were the vaccination rates for other vaccine-preventable diseases, we'd be having ongoing outbreaks of measles, mumps, rubella, polio, etc. We need these COVID vaccination rates to be substantially higher to impact ongoing transmission in the schools and everywhere else and stop this upward spike in the community. I want to remind everyone that we still have to quarantine. Remember, quarantine is for if you've been exposed to COVID under certain conditions, such as if you're not vaccinated and have been in close contact with a COVID positive person, you need to quarantine for 14 days or 10 days if you're not showing any symptoms. And day 1 is the day after you've had the contact. Think of the exposure date as day 0, then start counting to 10 from there and continue to watch for symptoms for 14 days. This is especially critical in school-age children because many are not vaccinated. The same is true if you want to shorten your quarantine period by testing. You have to wait until day 5 after your exposure to be tested. If it's negative, then after day 7, you can finish with quarantine. Again, remember the last exposure date is day 0 when you start figuring quarantine. This day 0 start time also applies to isolation when you isolate for 10 days if you test positive or have COVID symptoms. Day 0 is the date of the positive test or when symptoms started. Then you start counting day 1 as the next day. Got it? I know it's confusing, and the CDC website explains it further. Getting back to vaccinations, things just got a little more complicated since the FDA and CDC Immunization Advisory Committee approved a 3rd booster dose for the Pfizer vaccine last week. The vaccine should be administered 6 months after the 2nd dose of the first vaccination series. And keep in mind, this is only for Pfizer at this time. Moderna has submitted an application to FDA for a 3rd booster dose, but that is not yet approved. Johnson & Johnson is expected to request approval for an additional dose with their vaccine soon. So who needs to get a 3rd dose of the approved Pfizer? The most important groups to get an additional dose are people 65 years and older and residents in long-term care settings, and people aged 50 to 64 years old with underlying medical conditions. Now, those who should strongly consider a 3rd dose based on their individual benefits and risks include people age 18 to 49 with underlying medical conditions and people age 18 to 64 who are at increased risk for transmission because of their jobs or institutional setting. These recommendations touch a lot of people. Vaccine providers at doctors' offices and clinics are currently scheduling folks for the 3rd dose, with priority towards those with the most risk. Retail pharmacies are also scheduling vaccines and will sometimes take walk-ins depending on demand. To be sure, call the Sleeves Up phone line at 563-690-6600 888-888-6253 or visit the city or county websites for the latest list of vaccine providers and scheduling. So for those of you still contemplating vaccination or who are waiting for the full FDA approval, you'll have to come up with another reason, since the Pfizer vaccine is now FDA fully approved. Yes, it's confusing, with frequently changing recommendations on boosters, third doses, what it means to be fully vaccinated. Almost a year ago, we thought vaccines were 95% effective with 2 doses. So we began vaccinating and we continued to learn the effectiveness of this vaccine, particularly against severe illness, hospitalization, and death, which is what that 95% was based on. Then came the variants, particularly Delta, and we know that additional variants could develop, which would again change the vaccine recommendations. Now we're dealing with waning immunity, particularly in the elderly. So again, the data and science is being studied to further recommend new strategies to further protect against the virus, particularly in the immunocompromised and most vulnerable. We're now into fall and one of the most beautiful times of the year. Take advantage of the outdoors and fine weather. Who knows what the winter will bring? And we still have to be safe by wearing masks in public indoor spaces. And it's not even a bad idea to wear a mask if you're at a crowded outdoor event. Thank you all for tuning in and doing your part to slow and stop the spread of COVID-19, and please continue to recommend vaccinations. This is our best defense against this pandemic.